Hi, I'm Chloe Leary. I'm the Executive Director of the Winston Prouty Center in Brattleboro, Vermont. The Winston Prouty Center is the Children's Integrated Services fiscal agent in the region, and we provide early intervention, nursing, family support, behavior consultation, and specialized child care to young children and their families. We also work with our community designated mental health agency, HCRS, to provide early childhood family mental health. And we are fortunate that those team members, even though they work for HCRS, are actually housed here at the offices with us. So Children's Integrated Services is a unique way of providing supports to families with young children to help them support the development of their child. It is an integrated system that means that families who are looking for support they might need nursing or help with breastfeeding, or they might have a child and they have a question about their development. And so they come to Children's Integrated Services, and that whole team of people is here to support them. They don't have to go to multiple service organizations or have multiple plans. They come to Children's Integrated Services. They meet with the family. We talk about what they need and want, not what the professionals want to provide, but it's really based on their goals. And in that way, it's a very family centered and strengths-based approach, like understanding that families know their children really well. And we also have something to offer as professionals. So families can access services through one plan, one intake. We don't have to go all over town to figure out who can help them with their young child. So it's also much easier for people providing the services because it supports us to understand what are other people doing and how can we collaborate and work together to really support this family. Referrals come from any number of places: doctor's offices, childcare programs, WIC, DCF Family Services. So we really work collaboratively also with providers in the community who support young children and their families as well. So the team approach is actually not just about all those different professionals who work on an integrated team through Children's Integrated Services, but also extends to the community, because wraparound holistic supports are what's really important in giving our children and their families the strongest foundation they need. It's really one of the greatest investments we can make. The better our kids are doing, the better we will all be doing in the long run. Another benefit of Children's Integrated Services is that providers can really focus on sort of what they do instead of worrying about billing or who's going to get paid for what service. So again, in that example, if a family needs breastfeeding support and early intervention, that support can be provided when they need it by whomever they need to have in their home supporting them, and it will get paid for. The CIS case rate, it's a managed care model, not fee for service. And so the CIS fiscal agent does all the billing. It's pretty simplified, and that really frees people up to provide the service. So again, Children's Integrated Services is a great way for us to make sure that our children get the healthiest start they can, and that their families have the support to provide for their optimal development. It's the families who are going to be there for the long haul, and the best thing we can do is give them the supports they need and the knowledge we have to help them continue to provide that to their child. So CIS is one of the best investments we can do for the future of our state. And thank you so much for the work you do to make that possible.